Hi everyone, I'd like to start off with a riddle. I rise up for free the first and second time, but need me a third, I will cost you. Can you guess what it is? Most of us have them all. Our teeth from when we're young to hopefully when we're older. That's right. I'd like to talk to you about why it's important to visit your dentist and why we need them. For this, I thought I would work best speaking with my father, who was a dentist back in the day, seeing the differences and changes of dentistry over the years. With a background of 10 years plus in the dental field, educated in Paris, France, where he received his Doctor of Dental Surgery in May of 1980, as well as a Doctor of Philosophy in the specialty of periodontiology in May 1988 in Stockholm, Sweden. Some of us go through life uncertain and insecure whether or not we are headed in the right direction. Are we following just the money trail, or are we creating a purpose for our lives? For myself, this occurred at a crossroads when I had graduated high school in June of 2013, having to decide if I should continue my education in college or join the military, because at that time I was not sure of myself and what I wanted to do. Finally, I chose to do both, joining the Army Reserves and going to university. This is a perfect example of Maslow's hierarchy of needs, in particular my safety needs, esteem needs, and now self-actualization, all blended in. Now I have served 4 years in the Army Reserve, received multiple different rewards, bettering myself each and every day from the values I've gained during training, and soon a bachelor's degree. One decision led to opportunities I would have never imagined. We all have stories to tell. My father has been one of the most important role models and influences I try to follow in his footsteps. Ultimately, what does it mean to be a dentist, and what impacts do they have on individual lives? In my opinion, there are three main points to understand. Some of the reasons why dentists do the kind of work they do. But you don't have to take my word for it. In this interview, we covered questions that were closely related to the early beginnings of my father's life, from traveling on sea as a dentist for the French Navy all the way through becoming a dental surgeon. The lessons and hardships he learned on the way, the passion and interest he discovered. Why did he choose to be a dentist? My father always wanted to work in healthcare, either as a medical doctor or a dentist. What made him choose the dental field was the fact that he could combine his intellectual and practical skills. This meant he could use his medical knowledge of how the body functions and diagnose a problem along with immediate treatment, be it restoring a smile, improving the ability to eat, treating an infection, or diagnosing a general illness of the body that expresses itself on an oral sphere. Mouth reflects the health of your body. Though there are many different reasons for pursuing a career in dentistry, and majority of individuals to choose to specialize in a specific aspects of the practice. So, is there any particular aspect of dentistry that was more interesting to him? This really depends on your own interest. For my father, he specialized in periodontiology, that is a science dealing with the supporting tissues of the teeth, the gums, the alignment surrounding the root of the teeth or tooth, an underlying bone. He believed that before you can reconstruct visible part of the teeth, that is the crown, you need a solid foundation. The same that would apply to a house. In addition, at the time my father was a student, implantology was a new developing technology that led to his fascination that you could replace a tooth was missing with a dental implant without having to work on an adjacent teeth, which was sometimes intact, as you did past when you were preparing a bridge. As one can see, there are many different aspects in dentistry, some being rewarding while others less. What was the most and least rewarding moment as a dentist? The reward as a dentist is almost instantaneous. Somebody comes to the clinic with a serious toothache, and you can make the pain disappear in a matter of minutes. Or a broken front tooth that you can restore in its original shape in a matter of minutes and make the patient smile again. A medical doctor can see a patient for years without curing his or her illness, but providing a chronic treatment that will extend his or her lifespan. One of the least rewarding moment as a dentist when you are not able to convince a patient about the importance of maintaining good oral hygiene through brushing and flossing. Preventing tooth decay or loss in such a desirable, which is a more desirable approach than treating tooth decay or loss through restorative work. As good as a dentist he is or she can never recreate an oral condition as perfect as Mother Nature did. Every doctor in the medical field serves as a valuable person and purpose. However, many individuals may overlook the importance of being a dentist. In the end, we've discussed a few explanations of fulfilling a career in dentistry and what qualities, even characteristics, it takes to make a dentist. From the passion to the education, from the negative to positive experience of a daily work, every person has a why behind their career choice. My father chose dentistry because he could figure out a way to combine his education level and his hands-on street smarts together to become a successful doctor in various medical fields, which he uses even to this day. Though he faced his own challenges, like we all do, he made the choice to help others and change the world one mouth at a time.